Hi, everyone. Welcome to the last week of our Cat Chat Live summer webinar series. My name is Nancy Stevens, and I manage parent and family communications for the University of Kentucky. I hope you've been able to tune into our other webinars in our series, and I hope that they are answering a lot of the questions that you have about UK, or maybe helping you think through things you didn't know you needed to know about UK. We've got another great week of topics. We're going to be focusing this week on the health and safety of our wildcats. And so today's topic specifically is wildcat wellness. And so in just a few minutes, you're going to get to meet folks representing student well-being and the Office for Student Success and University Health Service on the UK healthcare side. But before we do that, I've got a few housekeeping items, as always, to review with folks, particularly if you haven't joined us yet for our summer series. We're going to be using Zoom's Q&A feature to communicate to each other today. So after all of the presentation, the slides have been reviewed, we'll open things up for your questions and encourage you to use the Q&A feature to chat with us. We'll take as many questions as we can in the hour that we have allotted together today. My colleague Kate in the Office of Family and Civic Engagement is going to be putting relevant links, dates, things that you need to know in the chat, so be looking for those. If you're not able to join us for the entirety of today's webinar, like all the other Cat Chat Live webinars, this is being recorded and the recording will be uploaded in the Cat Chat family community later today. If you have questions about other UK topics outside of wellness, we are happy to answer those after the webinar today. You can always email parents@uky.edu to get assistance from the Office of Family and Civic Engagement. And I would be remiss if I didn't remind you that we always want your feedback on the communications, the services that we're providing to you all as the families of our students. And so after today's webinar, you'll see a survey link, and we would love if you would take just a moment or two and answer a few quick questions about your experience with today's Cat Chat Live. As I mentioned, we're wrapping up our summer series. On Wednesday, we'll be chatting with UK Police about all things campus safety. And I've started working with my colleagues on campus to line up our fall topics. So more coming soon, but right now, we're already looking forward to a family weekend preview and to celebrating First Gen College Student Week. So registration links for all of those webinars are in the Cat Chat family community. And if you're not able to join us live, the recordings are there afterwards as well. Always got to put in a plug for the Cat Chat family community, our one-stop communications portal for UK parents and families. Make sure you're continuing to check out those email newsletters it's sending you, the calendars of events that are in there, easy ways to share information with your Wildcat. So make sure everyone in your students' support network is part of our Cat Chat family community so they can stay up to speed on how to best support your student. So those are all of my housekeeping items. So I'm going to turn things over to Dan Bureau, our Associate Vice President for Student Wellbeing in the Office for Student Success, and he's going to share a little bit more about what he and his team do to support our students' overall well-being, and then he'll turn things over to University Health Service. Thanks so much for being with us today.
Thanks, Nancy. Thanks, Kate, for all the behind-the-scenes stuff you'll be doing. And I do want to thank all of you for choosing to engage in this Cat Chat today, or whenever it is that you take advantage of the opportunity to listen to this. The investment of parents is really important to the success of students here at UK. I have worked at a different campus with parent and families, and want to thank the work that Nancy and Kate are doing in this space, because you all really do help us make your students' experience here successful. And we also want you to think about UK as more than just a place where students come and they get their major, or they get some classes, they get a degree and they get a job, right? We organize things here at UK under what's called student success. Many of the out of classroom services that your students receive will be through any of these four kind of verticals, we call them. And I know that in previous times, previous webinars this summer, you've talked about some of our belonging and engagement opportunities, some of the ways to help your students manage some of their finances, how they might be academically successful. And I'm really pleased today to join my colleagues from University Health Services to talk more about how we can facilitate your students' well-being. And again, we want UK to be a place where your student develops that plan for well-being and finds all the resources and services that they need in order to enact it. We believe that well-being is really important for your student being successful, though, and I'll talk more later on about the challenges that your students face at this point in their lives. But we know that they have to tackle some significant challenges sometimes in order to stay here and be happy and graduate. And so we put a lot of time and energy behind these resources, these services, in order to help your student be successful. Because for many of them, they haven't really navigated this idea of well-being previously on their own. And gratefully, parents and families are often actively engaged in this. And we know that every student comes here with a different level of autonomy or ability to manage their own health and well-being. But what I'll say is that when students come here, they're given opportunities to make decisions that will impact their health and well-being. And they make those decisions sometimes with less input from external forces such as parents and families. So we know that whether it means going to UHS for an emergency or a kind of an urgent care clinic kind of service, or seeing one of our counselors, or getting engaged in our campus recreation area, or getting accommodations, whatever it is, we know that students come here with a lot of questions and needs, and parents and families have helped a lot previously. Now we're going to provide services and resources to help them be successful. And we want you to think about how we frame a lot of the stuff we do as students moving from this place of being dependent on others into being independent and making their own decisions. Now, to be clear, what we're really talking about is a level of interdependence. And we know that parents and families are really pivotal in making that happen for our students. And so the people on this phone are part of your network, of your support system to help your students be successful. And we're going to help them move from that place where they are dependent on others to where they can make decisions in partnership, all the way to making decisions for themselves as emerging adults. President Capilouto talks a lot about this idea of lives of meaning and purpose. We believe that in the well-being areas that I'll talk about today, we are helping your student develop some of this skill set, but it won't be easy, right? There's a lot of things that students go through at this point in their lives. And for traditional age college students, it also coincides where a lot of maybe some things that might have just been emotions and feelings and behaviors, when they start becoming more of their kind of identity and how they kind of live their lives. And you can see on the screen here, there's a lot of challenges your students are going to face. And all of these are very natural that they might experience them. Stress, anxiety, depression might be clinical and might not be, but a lot of students experience these kinds of things. It's hard to make that transition to college. They come to college, they're sitting in a class with 120 other students. As they progress, there'll be maybe some smaller classes, but sometimes those learning differences kind of manifest in those environments. I mean, students are making decisions about how they take in knowledge and how they're able to demonstrate mastery of that knowledge in their classes. We want them to attend to their physical health. We want them to understand what it means to have a diet and approach to life that is that prioritizes nutrition, and that is to be determined by them in terms of how they want to prioritize that. But we want to give them lots of options to make those decisions. Your students will certainly be in situations where they may not prioritize their sleep. And that's going to be a challenge. That'll present some real difficult circumstances if students don't manage that because they're still developing this part of their brain. And that sleep is super important for them. Your students will likely be exposed to substances and they may make decisions around whether or not they choose to use them and to what extent they use them. Some students might find themselves in experiences where they just feel isolated and they don't know how to interact with different people around them, or maybe they've come from 100 miles away or 10 miles away, it doesn't really matter. To some extent, your students are experiencing a sense of significant transition, and they might play that out in different ways. And we want to be the services and the resources that your student needs. They have to manage priorities. A lot of students are working. A lot of students are having to manage relationships, those kind of things. And those relationships bring about some real propensity for some interpersonal conflict. College is the first time that some students will really navigate a conversation or an experience that brings into a different perspective for them. And so it's important that they can talk through what it means to make sense of that and also internalize that in the ways that are most meaningful for them. And then finally, this last bullet about a lot of students come here maybe having higher expectations for themselves than maybe they. But what we want to do in student success is provide all the services, all the resources with our partners from UHS, from our partners across the campus and all the colleges to help them manage this kind of natural state of change and dissonance as they become adults. I want to talk a little bit before I get into some of the areas that I supervise in our well-being, but that level of dissonance is pretty strong, and it really can disrupt the ways that they come to know the world. And every time a student gets into a situation where they don't have the knowledge or skills in order to enact a strategy to manage that, they might be thrown into a state of crisis. And that might be a small C. They can easily navigate it. They know how to find the resources, or a larger seed. Maybe they need a level of clinical support in order to navigate that. But what we know is that this is temporary and students will experience this. But the excellent resources we have here at UK are certainly in place to help your student be successful. And I really want you to know that we are committed to helping students from the time they start here all the way throughout their time in order to navigate that. So whenever your student has a cause for concern, enters into a state of crisis, needs some support, whatever that looks like, we have supports here at UK to help them. We structure our well-being services into 8 dimensions. I won't go too much into this because I think anything is well-being. So whatever it is across the campus, I could tie it back to that. I'm going to focus today on some of the resources and services that we have within the well-being arm that I supervise that can be really helpful for your students. And it'll focus on the emotional wellness of your student, the physical wellness, and a little bit of the intellectual wellness. I'll start off with Disability Resource Center. And many of students come here and have experienced either an IEP or a 504 in the secondary educational environment, that K through 12 environment. I have a 10-year-old. She has a 504 in order to address her ADHD, anxiety, and depression. She's 10. But when she goes through high school, I hope that she'll maintain that and develop strategies. What happens when you go to college is that that 504 does not transfer. You have to come ready with your documentation in order to submit for accommodations. The documentation is reviewed. The documentation is from a physician, a provider, a clinician, whatever it is, and then the office here, Disability Resources, can help determine what accommodations work best for your students in this environment. Campus recreation, we have two excellent facilities. We have a very beautiful campus, so it's easy to get out and do things across the campus. But I'd encourage your student to use our alumni gym in the Gatton Student Center or our Johnson Center. And both of those services are provided as a result of fees that your student pays. So access to group fitness, cardio, intramurals, weights, outdoor education, whatever it is your student needs in terms of managing their own goals for physical wellness, we have that here through our campus recreation program. Our power unit is what provides health and safety and wellness education across our campus. If your students join clubs or live in residence halls, they're probably going to have the opportunity to hear some of the great education we have around health and well-being provided by our power area. And one of the most exciting things that I've seen this team work on for the fall is that if your students in UK 101, they're going to have the opportunity to work with Power to create an individualized well-being plan based off of those 8 dimensions. In a moment, I'll talk more about some of the educational requirements that Power kind of coordinates, but I don't want to get away from these unit overviews. So let's shift a little bit to tracks. If your student would like to engage in a therapeutic relationship or be referred to services in order to address some sort of challenge they're facing, they have to start with tracks. Tracks offers 1 to 2 visits, typically about a half hour in duration, that allows a clinician to work with your student to identify what is the real challenge here and what services do you really need. What we don't want our students going into the counseling center and saying, oh, I'm so stressed about my career. Well, this isn't anxiety or clinical stress. It's that you just need to explore careers. So let's refer you to a different service. Same with academics, same with connections and belonging. And so Trax allows us to do that and to mitigate wait times for our counseling center. Um, it typically takes no more than 5 business days in order to have a scheduled appointment within Trax, and typically that's a result of student schedules. So pretty much it can be seen day of if your student is in crisis. Information can be found on our website for Trax as well. UK Counseling, we provide a short-term therapy model, up to 10 visits a year that is clinical in nature. Once we get more to that point where a student might need to be referred to an external service, we have that conversation with the student. But these are also covered as part of well-being fees that your students pay. So all these services, for the most part, are entirely already included in the fee schedule that you all are managing already. So tracks, counseling, those are services that come at no extra charge to you. Our last department that I supervise is our VIP area. This is for violence intervention and prevention. This is an office that provides confidential advocacy and support for survivors of interpersonal violence, whether that be sexual assault, stalking, whatever it is that has brought a sense of trauma to an individual as a result of that interpersonal relationship going wrong. We can help them, your student, navigate that as well. Again, that's free and confidential, that can be accessed through our well-being website. The last thing I'll say before I turn it over to my colleagues, this is not forwarding. There we go. I know some of you have questions around a few deadlines and requirements. I want to provide just a short overview on both of those. The only immunization we require verification of is meningitis, and this is for students who choose to live in our student housing. Meningitis it spreads very quickly and can be quite deadly if not addressed, and so documentation is submitted through the housing portal, and that allows the student to verify that they've had that vaccination. For any of our vaccinations, if you request a religious exemption, you can submit that through me. There's information on our website for that as well. But this is part of our housing requirement in order to demonstrate that. And then the other thing is the completion of educational modules. We require 3 educational modules, alcohol, sexual assault prevention, and hazing. Hazing is new this year based off of federal legislation that requires us to inform the campus community about what hazing is, how it can be problematic, and how you can intervene when you are in those situations. Comparable education is provided for alcohol as well as sexual assault prevention. All those 3 modules take less than 3 hours to complete across the board and can be done prior to when your student starts. I will say that there were some email communication issues when that message went out a few weeks back. I think we've resolved those, but if not, please feel free to email wellbeing@uky.edu and we can resolve the problem that you're having. All right, I'm going to turn it over to my friends at UHS and I'll entertain questions later on.
Good afternoon. My name is Janie. I'm the nurse manager here at University Health Service, and I'm joined with my colleague Kelly Harden. She's one of our nurse practitioners. We're going to do a little presentation for you, and then we will welcome some questions at the end. So what we want to talk about today is some of the services that we offer at University Health Service. So you can see on your screen, we provide primary care, women's health, and behavioral health here at University Health Service. We're located at 830 South Limestone. Our building is called University Health Service Building, and our clinic is on the 2nd floor for primary care and women's health, and on the 4th floor for behavioral health. Our hours are Monday through Friday, 8 to 5 in primary care and women's health, and 8 to 4:30 in our behavioral health clinic. Now, I will say that we are directly across the street from the Speedway on South Limestone. So that's really the hallmark of finding us, and that's when we tell our students that they can usually locate us. There's a bus route that is available. It's the blue-white route, and that will drop your student off right in front of our building, and then they can hop back on the bus after their appointment and get back to their classes. We don't have a great central parking area for the students. It's right on campus, so we can have them park across the street in our hospital parking or in the clinic parking adjacent to our building. Importantly, this is how you would schedule an appointment to see one of our providers at University Health Service. Go through your MyChart or call our appointment line, and you can see the number there. Now, the appointment line for behavioral health is different, and it is noted on the screen at 859-323-5511. So what's important to bring to your appointment? Your student will need to bring their student ID, any insurance cards they may have, a list of current medications, and allergies. Anything that is not covered in our health fee, and we'll go over that in a few minutes, will be charged to their insurance. And so if that's not available, they'll also need to bring a credit or debit card. And then we have also we have a pharmacy in our building downstairs, so they would also need to bring that debit card for any medications that they needed to pay for. So this can be kind of confusing. So what we're gonna try to focus in on are the things that we can talk about that our health fee covers. So the health fee is already included in tuition, and it's mandatory for all full-time students, so you've already paid for that. It is not an insurance plan, and there are no copays or deductibles. So conversely, there's a health insurance plan, and that is an option for purchase for it as an insurance plan for students through Anthem, Blue Cross Blue Shield. And we basically recommend this for any student without insurance coverage or with a high deductible plan. There's an option for dental, and there's more information at UKY, myahpcare.com. So going back to the health fee specifics, as you can see on the screen, things that are covered are all office visits for the year. A strep test, UTI test, STI test, urine pregnancy, mono, finger stick, blood sugar test, and select medications. Not covered would be a COVID test, a flu test, blood work, x-rays, MRI, CT, urine drug screens, ADHD testing, genetic testing, immunization, and dentistry. So what we might do is have a student come in and their office visit is covered and they need a strep test. They also need a flu test. So that flu test would be billed to insurance. Yes.
Yeah. So, as Janie said, my name's Kelly. I'm one of the nurse practitioners here in student health. So let's kind of break down primary care, women's care, and behavioral health. So in primary care, we cover a little bit of everything. We do sick visits, acute injuries. You fall on a sidewalk, fall off a scooter. We're here to help. We do offer telehealth services. If the student's too sick to come to us, we'll come to them via telehealth. Physical, just wellness visits in general, chronic disease management such as hypertension, type 2 diabetes. We don't do type 1. We'll help you get resources if you need that. STI testing and treatment, lifestyle management, and any kind of sports medicine, like I said, fractures or, strains and sprains and things like that, we're happy to help with. Suggested things for the dorm. They're going to get sick. It's the first year away from the population that they're used to. They're going to come to a campus with like 36,000 students. They're going to get sick. And we're happy to help with that. But good things to have on hand from one parent to another is a thermometer, some Benadryl. They're going to get a rash, Band-Aids, cough and cold medicine, ACE bandages. Like Janie was saying, the COVID and flu tests aren't covered under your health fee. We're happy to do that. We'll put it under your insurance, but if you don't even want us to deal with that, Kroger, Walmart, they sell those tests. You can buy 2 for $25 now over the counter, and they'll do COVID and flu. And all the student has to do is do a telehealth with us and say, hey, my test is positive. We'll help from there. Pepsid, Dramamine, Pepto for the upset bellies, and Tylenol and ibuprofen. If your student is on any medications chronically, we do recommend you check with your primary care provider to make sure there's no interactions with our recommendations. Pharmacy information. Students come with medicine. First, before I did not put this on the slide, but I'm going to say it before I forget, make sure your student comes with about a 30-day supply of medicine before we have to deal with getting them refills. It's always good if they come with medicine. If they've been on it, get them a current script for it. Send them to campus with medicine. But after that, if you want to transfer medications from your home pharmacy to a campus pharmacy, you just have to contact your home pharmacy and say, I need to transfer this prescription to here. You just need to let them know where you want it. We do have 2 campuses, 2 campus pharmacies. one in our building at UHS and one at the apothecary, which is at the student center. So those, and then we also have lots of pharmacies around campus. There's Kroger and CVS at Target, and we have Chandler Hospital and Good Sam Hospital. So there's lots of options out there, but those are the two kind of campus dedicated pharmacies. This, of course, will not be applicable to controlled medicines. Those can't be transferred, but I would talk to your primary care provider about how to get those to a local pharmacy. Nursing appointments, we do offer nursing appointments for lots of different things. First and foremost, allergy injections. We get a lot of questions related to allergies. New patients that are coming to UK, we just advise you to go ahead and schedule an initial nursing appointment, and they'll talk to you about the process. But we do want the serum like mailed to us versus your student handling it, just to make sure everything's refrigerated properly and handled properly. But we're happy to take that over for your student. Compliance, especially related to the health science colleges and international students. We want you to come meet with our nursing staff. We'll get your compliance all up to date and ready to go for those requirements. Also, if your student is like, do I need to come in? Do I need to do a telehealth? Do I need to go to the emergency room? Have them call us. They can talk to one of our triage nurses and they can help decide where your student needs to be seen at, where's the best fit. Women's health services that we offer. We do offer preventative care in relation to cervical cancer screening starting at the age of 21. We also see just kind of acute problems of pelvic pain, PCOS, vaginal infections, UTIs, breast concerns, menstrual problems, STI, STD testing, birth control options, including pills, patches, IUDs, Nexplanons, and then pregnancy testing and counseling. We do follow all ACOG women's health guidelines here. We have a behavioral health department that's up on the 4th floor of our building, and they offer lots of services, but their primary focus is medication management. Like Dan was saying, we have the counseling center, we have tracks, those are your gateways, and they're going to get you lots of like counseling services, but medicine really needs to come through us. And our behavioral health department can help handle that. The initial assessment's more of an assessment, diagnosis, and recommendations. We do offer crisis intervention treatment, limited therapy, and referral back to campus or community resources. Those visits are covered by the health fee, but any medicines, testing, or labs that they might recommend or do would not be covered by the health fee. Things that they commonly see in office are anxiety, depression, ADHD, PTSD, OCD, eating disorders, mood disorders, sleeping disorders, and more. ADHD is a common question that we get because those are controlled substances and they're not, easily transferred. So if your student has a formal diagnosis of ADHD and is on medication, they just need to bring their copy of that evaluation to the first visit with behavioral health, and they'll kind of take over from there. If your student is interested in pursuing a diagnosis of ADHD, we do offer the testing. It requires an initial evaluation, then the test, and a follow-up. It's not a one-stop shop. There's got to be an evaluation to it. We related to those things, the urine drug screen and the medicines are not covered by the health fee. We will put those through insurance. Just some good resources to have. Our website kind of goes over everything Janie and I talked about. If you're interested in purchasing the additional Anthem student health plan, Shabay Mock is your contact for that, and that is the email and her phone number there. And then if you are interested in the student dental plan, again, there's the website to access that information on how to sign up.
All right, that was some good information y'all went through, and questions have started to come in, so we'll take those now. And folks, if you're thinking of questions, go ahead and use that Q&A feature, and we'll take as many as we can in the remaining time. All right, first viewer for Dan, as folks thought of them while you were presenting. The first one says, where do students complete the educational modules? I thought this was already done with the housing application. Now, Kate put the link in the chat for folks to go back to. But Dan, if you want to speak a little bit more to how students became aware of the educational modules.
Yeah, the educational module email would have been sent out in the last couple of weeks, including a reminder. Again, as I mentioned, the first one had some problems and landed in many people's quarantine boxes. It's a long story there, but the reminder had no problem. So students should have received it at their UKY address. It also can be seen by going to our well-being website. If you were to go in and just type in well-being educational modules UKY, it'll go right to the page you need. And on the bottom right-hand corner, there is a link to log into the portal and begin the whole process. These are done by an external vendor, all 3 modules. And so if there are concerns or questions, again, please do email the wellbeing at uky.edu. But ultimately, through the email, by going to the wellbeing webpage or logging into the portal, they should have access to the educational modules. The housing portal is relative to the immunization, and that is where you upload your documentation that you have received the meningitis vaccinations.
I was muted, thought I was unmuted. You think I would have been aware of that by now. Anyway, Dave, you went right into the next question, which was asking for a reminder where the link is to upload the meningitis verification. And then we also had someone ask if you could revisit how to get an exemption from that requirement.
Yeah, I think it's easy enough to type in exemption, immunization, UKY. I don't know the exact website, and also probably wouldn't be helpful for me just to cite off a URL here, right? But by going to the UK site and typing that in, you should have access. And again, if you can't find it, please can you mute yourself again? Sorry, thanks. Yeah, if you can't find it, then just go to send an email to wellbeing@uky.edu, and I'm happy to send that information along to you. Another fun email is immunizations@uky.edu. So either one of those works. Or just use my name and look me up, just like the FBI Bureau. So happy to resolve whatever you need over email.
Just to piggyback onto that, Dan, they could also go through their My Chart and they can request a religious exemption through their My Chart. They go under questionnaires and they can see in that part where they can upload their request for an exemption, whether it be medical or religious. And there's an option to link the if it's medical, you can link your physician note to that and just submit it that way.
All right, good deal. Our next series of questions are for Janie and Kelly. Kimberly says, my daughter will be an undergrad student and is already enrolled. She called the on-campus medical facility to make an appointment. The available appointments until November. Is this due to the type of appointment she needed? So Kimberly doesn't say what type of appointment she was seeking, but if you could talk a little bit about appointment availability and kind of turnaround time, that'd be great.
Yeah, so we're a little confused on that one because we are wide open and ready to see these students, and I've got appointments honestly open today because I'm going back to clinic here in about an hour. So I'm not for sure which clinic got called. So we do have on the 3rd floor an actual UK healthcare internal medicine clinic that is not associated with student health. We are on 2nd, behavioral's on 4. I'm worried that got contacted instead of us. But if we can go back to our slide with our contact phone number, if she wants to just call us, our appointment number, it was toward the beginning, not that one. Keep going just a little bit further. It's almost, yes, right there. If you want to call that 859-323-2778, I bet we can get that worked out for you. Normal goal for us to see students, especially sick students, is within 24 to 48 hours. We try to do a quick turnaround. Once we're back up and staffed and students are coming at us, we run about 12 providers a day. We see about 300 students a day. We really try to make sure that our access is doors open wide. Now that's related to student health. Behavioral health, it's a little bit different. We still try to get people in, but the wait times are more like, they can be up to like a week or so, but never November. None of us are November. So I feel like, unfortunately, a different clinic got contacted, unfortunately. Go ahead, Dan.
Yeah, I'd like to also add, I'd like to correct an incorrect narrative around wait times for some of my services as well. Oftentimes, people perceive that it takes months or weeks or whatever it is in order to see a therapist. If you go through the right process and you start at tracks, you are seen within 5 business days. And again, that's typically a result of what the student schedule demands. Students in crisis can walk in and be seen day of. Tracks is the front door to counseling. Once you are set up in order to engage in a therapeutic clinical relationship with a therapist at UK Counseling, the maximum we aim for is 2 weeks. And I don't know about anyone else in this call, but if you can get an appointment at a counselor or a psychologist or whatever within 2 weeks, that's pretty awesome. We might go a little bit above that during peak times in the fall, but if your student says, oh, it's weeks and it's months, send them to me and I'll look into that for them. But there's a good chance it's just a result of a bunch of factors, or maybe they're just not accurate. So please do reach out if you ever have those problems or concerns.
All right, that is helpful. Yeah, when I saw that note about November, I said, oh, I was thinking to myself, oh no, that must be a different clinic because I know UHS strives to get students in quickly. All right, Andrea is saying my student already has my chart for healthcare in our hometown. How does she link UK to her existing account?
So there is a way, and I apologize because I've not had to do it, but there is a way that you actually can log in through that ukhealthcare.uky.edu/mychart, and there's a way once you log in to merge the two accounts.
But they have to do it.
But you'll have to do it. The student does, because this is now their account. Like they run this show. Parents do not get proxy. Your student is running the show now. But there is a way for them to start with UK Healthcare and then merge the two accounts.
All right, then our next question says we have insurance with a high deductible plan / HSA. Why do you recommend SHIP for the high deductible plan?
So if you have an HSA and you're able to cover any cost that could accrue, great. We have ran into, and it's not all the time. It's about once a year. We have a student that's out of state that has a really high deductible plan that maybe needs x-rays or something, and maybe some other medicines and some things, and the cost starts adding up pretty quickly. But yeah, HSA, great. Not a big deal. We just always want students that have high deductibles to think about it. But yeah, if you all have a high deductible plan, but you've got an HSA plan that you've already kind of budgeted in, it should be fine. I would not purchase anything unless we have to, but in addition to what you're already paying.
That kind of leads us in nicely to the next question. It says, does the office delineate with the patient for what is and what is not covered under the plan before administering the service?
We try. So we try to be very transparent. However, it is good to know if UK Healthcare is in your insurance network, because if the student falls and hits their head or twists their ankle and we need an x-ray, we need to make sure we're not going to know exactly if we're in your network to cover that cost. We're going to bill the insurance. So it's always good, one, to find out if UK is in your network. But yes, we try to be very clear. Like when I have students come in that are sick and they've got a sore throat, I'm like, strep test covered. If it's negative and you want a COVID and flu, we're going to have to charge mom and dad's insurance. Are we okay with that? So we try to be transparent with what is and what's not. But we don't know every insurance plan. There's 1,000 of them out there and they change almost daily. So we can only tell you the little bits that we know, and we try to say, here's how this is going to go, and try to do the best we can. Are we 100%? Nope.
Well, speaking of insurance changes, the next question is, will families be notified if the status with Cigna changes?
I would assume. We got a letter when it changed that we were no longer in network. So I would assume we would get a letter when that went back. But that's an assumption.
Yeah, mine would be the same thing. I remember seeing the announcement about Cigna when the initial change happened. So I would hope that it would happen on the flip side too.
Correct.
All right, so our next question is about pharmacies. It says, are medications transferable to an on-campus pharmacy if the student is out of state?
As far as I know, yes, it's just not a controlled substance to be transferred across state lines. I think if you just have like, let's take birth control because it's an easy one. Birth control should go wherever. You just need to do a pharmacy transfer to transfer.
And I got some information from the apothecary this morning that I just put in the Cat Chat family community, and I dropped that link in the chat as well. All right, we've got some questions about allergy injections. The next one says, who can I call for more info on allergy injections and what is and is not covered under the required plan?
Okay, you can just, if you want to speak to one of our nurses, you can, I can give you the number now, or you can, I'm just gonna give you the number. It's 859-323-4636. That's our triage nurse. Or you can call the number on your screen, 323-2778, and that is, you can ask that, tell them that you want to speak to the triage nurse, and then we can help you from there.
All right, and then the next allergy injection question says, will the clinic inform our students this year when their allergy shot medication is delivered from our home doctor?
We can attempt to do that. We usually try to reach out through my chart and send a note that way. We have, hundreds of students, and so we do kind of put that onus on the patient to call and make an appointment. And we usually will notice if they have an appointment and we don't have their serum yet, but we'll do our best with that. But we do like the students to kind of reach out to us and to make the appointment and make sure that we have their serum first. We do try to send a note through their My Chart, but sometimes it's hard for them to see those messages if they're not checking.
Yeah, they need to make sure those notifications are turned on.
Correct.
All right. Then Heather is asking for clarification. She says allergy injection serum needs to be mailed. If so, is there a link to the process?
The allergy medications are sent from your home allergist office. So they will ship it to us. They should have us listed in their source providers, and it's 830 South Limestone in Lexington. So it's UHS. And that, I think our address is listed here in the slides.
Yep, and I think Kate got in the chat as well. All right, Elizabeth is saying, can you please share the link for where to see additional insurance? And so I think Kate may have put that in the chat, but if not, I'll ask her to do that. You all also briefly, go ahead.
Oh yeah, it was the slide that gives Chevet's information for Kate to share.
All right, perfect. Yeah, Dan's gonna navigate this back there too. Perfect. All right, then Julie's saying, is there a dentist available on campus? I know you mentioned a little bit about dentistry here, but if you could speak a little bit more to that.
Sure. UK Healthcare does have dentists. They have a resident program, they have a faculty program, and then they have just general dentistry at Turfland. It does depend on your dental insurance. So it's always good to make sure, again, UK's in your dental network, but yes, there is, it's not covered through your health fee. Nothing with student health fee is related to dentistry in any way, but definitely they take most insurances, commercial insurances, and they're happy to see your student. But there is a resident program and a faculty program.
Yep, I've gotten my dental care through the faculty program for years and years. All right, next question is, does University Health Service provide full lab services?
So so UK Healthcare has a lab in the building right beside of us, and we do offer labs. If as appropriate, I will order labs on students. And again, it's always good to make sure UK Healthcare is in your network to make sure they're going to pay for those labs because they are not covered under your health fee. So if I've got to send a student for a thyroid panel, it's going to have to go through mom and dad's insurance. So definitely making sure that UK Healthcare is in your network.
All right, Sean's next question I can actually answer based on a previous Cat Chat Live. He says, my son has managed a self-carry EpiPen for his nut allergy. How does he learn about which foods within the common dining halls may contain peanuts? So we did a Cat Chat Live webinar with UK Dining early in the series, and the link is in the Cat Chat family community. But in the Fresh Food Company in the 90 on South Campus, and in Champion's Kitchen, our dining facility in the Gatton Student Center, both of those locations have True Balance stations that are free of the most common allergens. There's also really good information on the UK Dining website, and UK Dining has a dietitian that will meet with students as their allergies and how they can manage those on campus. So I would encourage you to check out that Cat Chat Live with UK Dining. I don't know if there's anything anybody else wants to add, but I know we've had that question earlier in the summer. Anything else about EpiPens or, managing those food allergies that I've missed? All right, sounds like we're good. All right, so our next question says, where do we find forms that my son would complete to allow doctors or healthcare professionals to talk to and release medical information to a parent now that he's over 18 years of age?
We can do that when the student arrives at for an appointment.
All right, so that'll be part of kind of an initial intake and all that.
Yes.
Good deal. All right, so our next question says, how best to let students or teachers know that I'm ill and cannot attend class? I think one of the learning curves I see in particular our first year students is trying to make the decision on their own. Am I well enough to go on to class? Am I too sick to go to class? So how do you help students navigate that?
Good question. That can be hard. One, if you're having a fever, of course, we don't want you going to class and spreading that. Anything over 100.5, you should not go to class. You should, and you may not need to be seen. You may not have a fever tomorrow, but definitely we don't want you, if you're going to have a fever. We always tell students when they come into the clinic, reach out to your professors as soon as possible, let them know what's going on, and then you're not going to be in class. They take attendance. Each professor is going to have their own attendance policy. You might get 2 freebies a semester. You might get no freebies a semester. It just depends. You may get a freebie if you have a doctor's note. We're happy to see that, happy to help accommodate that. That's again why we offer telehealth. If you are like, you know what, I ate something bad in the cafeteria, I've had some nausea, vomiting, and diarrhea, I'm starting to feel better, I just need a note because I missed my AM class, that's a telehealth appointment. We're happy to help you, give you some advice on how to manage that, give you a doctor's note, see how you're doing the next day. So I hope I answered that question.
So I would say also, when in doubt, call our number, call the appointment line, and ask to speak with a triage nurse. And she's going to be able to guide your student as to, yes, you absolutely have to come in today, or next steps.
Dan, what would you add there?
Well, I think this is an important time in a student's life where they're learning to communicate with individuals that are in a different kind of position than they are. And faculty can be seen as very intimidating. What they should do is write a clear email saying, "Dear professor, whatever, I'm going to be absent today as a result of this. I will review the syllabus and make up the work, or this will be one of my absences." I mean, they have to be informed about the faculty member's approach to managing the class, as my UHS colleagues had referenced, but also it's an opportunity for them to articulate to an individual that they should have a relationship with about that they're trying to manage their health as well. And so more often than not, I think if a faculty member gets a really like a well-written and clear message that says, here's why I'm not here, here's how I'll make up the work, etc., they're probably going to work with your student. Is that your experience, Nancy?
Yeah, that's what I was going to share. Just even working with my one class that I teach every fall semester, UK 101, I always try to encourage my students to reach out to me. Obviously, if you're really, really sick, I get that sending an email may be hard, but as soon as you possibly can, reach out to the instructor, let them know what's going on. We don't say, did I miss anything important? That implies that there are lots of unimportant things happening in class. But I think making sure that they're keeping a clear line of communication with their instructor is going to help build trust in the relationship. On the flip side, occasionally, once or twice in the time that I've taught, I've had a student who disappeared for like a week and a half. and then all of a sudden showed back up and said, well, I was really sick. Okay, can I see some documentation? Like they haven't communicated well in that time. I think they have not established some trust in there. So I would, yeah, always encourage students to communicate well with their instructors when they have to miss class for illness or any other reason.
I would like to comment on
Yeah, go
as
ahead.
well. I would also discourage any student from falsifying a note from University Health Service. That is not helpful. If you are sick, please reach out and we'll figure something out. But falsifying a note because you were sick 2 weeks ago, you've got this note, so you're just going to change the date on it. I promise you, it does not work. It does not work. It just does not work out well. So please discourage that behavior.
I would agree. I have seen one of those falsified notes. And again, I think if the student had just been really honest, I would have worked with them. But because they had decided to get creative with their editing software, they had broken trust in the relationship. And not that I wasn't still willing to help them, but we ended up having that conversation from a very different spot than if they had just been honest up front about their extended absences from UK 101. All right, so our next question says, please talk about fentanyl and the availability of naloxone.
Yes, we do have that available on campus. I am now not well versed in the many places it's being offered. We are creating a collegiate recovery community within our power unit, which will be one place where students will be able to access Narcan. There are a couple of student organizations that also aim to facilitate that promotion of Narcan. UHS colleagues, do you all have that accessible in your clinic?
We do.
I thought, okay. And there is also a website too, Nancy, right, where people can go. I feel like we've had some kind of effort before I got here. Sorry, I'm only 9 months in, folks. Before I got here to communicate about different places on campus where Narcan is available.
I don't know that website off the top of my head, but if we find it, we'll add it to the chat, or at the very least add it with the webinar recording in the Cat Chat family community. That was a good question. All right, Pam's asking, can we upload the medical power of attorney forms to my chart?
Not for sure on that one. So we would have to actually maybe come back to that one. I don't know in my chart that well about how to do that. Apologize. So we may have to send that to you, Nancy, afterwards and kind of check with our administrative people on that process.
Yeah, we can absolutely do that. And if you all send me that information, I can get it again with the recording there. All right, so our next question says, please remind who my student needs to contact to make sure her accommodations are on file. Additionally, will she receive scheduling preferences for next semester due to her accommodations? So Dan, that one's for you.
Yeah, you can go to our Disability Resource Center site, and the information is there in terms of accessing the portal where your student can upload the documentation that will allow our consultant to review and then determine the appropriate accommodations. People often ask if submitting a 504 would be advantageous. Maybe, maybe not. It could provide some context, but it is not here's the 504. It doesn't translate immediately into the collegiate setting in terms of accommodation. So what we really need is the documentation uploaded through the DRC portal. Relative to your students receiving scheduling, early registration, those kind of things, we will have to follow up with you on that. I'm not familiar with us doing that here. I'm not saying it's not a practice that we don't do, but I've not heard of that before in terms of preference for scheduling as a result of accommodations.
All right. The next one asked, Dan, this is also for you. If there is an emergent behavioral health situation, who should I contact to check on my student?
So that's a very complex question, and I think it could really be dependent on the student's past experiences and behaviors. And yet again, you're entering into a time in the student's life where some of these things start manifesting in really different ways. It's almost like that brain development and all the other things around that 18, 19 phase, things are just different, and the environment also influences that, right? Because of all the changes that your student's experiencing. If there is a challenge that your student is experiencing, encourage them to reach out to their residence hall advisor. That might be a good place to start. They also can be directed to any of our services, such as our tracks, by going and meeting with one of our case managers, our clinicians in tracks. They can help them figure out where it is they need to go. If it is a crisis situation where your student might need intervention, I would encourage you to call UKPD, who can enact the appropriate interventions and respond quickly to what the student needs. It's a very nuanced question, but I do think if there's any time in which you're concerned about your student's safety, I think referring to UKPD is probably the best scenario. We don't have clinical staff in either tracks or counseling that kind of enact those interventions. They don't go out and run to a residence hall and check on students. But between the residence hall, our Dean of Students area, as well as UKPD, those are probably the best avenues. I'd also see, Nancy, if you have any other thoughts on that response.
No, I think that covered it well. Janie, Kelly, anything else you'd add from a behavioral health clinic perspective?
No.
Yeah, I mean, of course, if, you know, like Dan said, all those resources, we're here Monday through Friday, 8 to 5. If you need us, we're here. We'll figure out how to get you to the ER or empath or call police or something, but like, definitely do what Dan said, but you know, we're here. Behavioral health probably won't have a same day, but we, even as primary care, can at least get, if there's an emergency, there's an emergency.
It's looking on the student.
All right, so I know we're getting a little close to our 1 o'clock wrap up time, but we've got a few open questions, so we'll try to get to these relatively quickly. So Lisa's asking for the link where students can connect their My Chart, and Kelly, I believe you said students got information at orientation that has a QR code on that, and you're going to get that information to me to share out to nudge families to nudge their students, right?
Yes, and there is the link in our PowerPoint as well that kind of gave you that link to go to My Chart. And then I did actually log into my chart to try to figure out that whole merge thing. And apparently, once you log in, if you swipe, it will take you, oh my goodness, it swipe left. And it says add organization. So you can add an organization. So you should be able to, I guess if you have a login through My Chart, you could bump add UK healthcare. Because like I said, I've never tried to merge a chart, so I had to go in there and play with that. So apparently if you swipe, it does give you like a little globe and says add an organization. So you should be able to merge from there.
Right, even when we don't know the answers to the questions, we'll figure it out with the student. We'll help them.
I know, I'm like, sure, let me log in.
Yeah. All right, so the next one says, if a student's managing a chronic health condition that requires labs potentially every couple of weeks, what is the process for a specialist sending lab orders to the UK lab?
So I'm assuming you have a specialist, like let's say a GI specialist who needs labs to maybe do an infusion or something. The provider should be able to just, if they have Epic, they can put the orders in Epic and then our lab can pull it from Epic. If they don't use Epic, it would have to be probably a paper order, either sent to the UK lab or your student bring the lab form to our lab to get that done. I hope that answers your question, but yeah, hopefully they have Epic maybe.
I'll add in real quickly that students may be eligible for accommodations based off of chronic health reasons. And I would encourage you to look at the Disability Resource Center page, because that might allow your student to explain absences and those kind of things to their faculty.
Yeah, that's a good tip, Dan. All right, Suzanne says, if under my insurance, UK Healthcare Hospital is in network, is it fair to assume that UHS is as well?
Yes.
Yes.
Good, that's an easy one. We've got a couple of Dan getting into the DRC. The first one says, my son had a 504 in high school, but does not feel that he will need accommodations in college. If he decides otherwise, will he be able to put accommodations in place at a later date?
He certainly can, but there's no harm in doing it on the front end, getting it done and using them when your student chooses. It's always up to them whether or not they want to use them, but getting it out of the way could be really helpful.
Then the next one from Shannon says, my son has a weekly injectable, which is delivered monthly and must be refrigerated. We've emailed the Disability Resource Center regarding getting a mini fridge in his actual room to keep the medication secure. Is email for that sufficient, or will a DRC accommodation form need to be completed?
I would encourage you to follow up with the DRC and request a conversation around that. I don't know enough to answer that one way or the other, but please do message them and get back to me if there's any problems there too. I can follow up with them as well.
All right. Melanie's asked a great question that I'm surprised hadn't come up earlier. Where do students go after hours if they need care? And says a local urgent care ?
Yes, we would recommend a local urgent care center that is covered by your insurance. We have a couple that is UK affiliated, but any little clinic or urgent care, we also have a list of those that we give students, especially during flu season. We give out and let them know where, somewhere that's near campus in case they don't have a car or they need to take the bus.
All right. So as we wrap up, I'm wondering if there are any final tips, things that haven't come up. As you all have alluded to, there's a learning curve for students in taking care of themselves more independently, and you all see it day in and day out. So there are any tips or conversations or things that you think families should try to prep their students for before our fall semester gets underway? What haven't we touched on yet?
I don't know if this is a tip or a trick, but we see a lot of students, especially that freshman year, that come, they've never been to the doctor without mom and dad. That's okay. We're going to walk them through that. The biggest thing is one, finding us. We'll take care of the rest. But it is good to make sure that they bring their insurance card. They know their allergies. They know what medicines they're on, and they got that student ID. Otherwise, we're happy to help in any way. They just got to let us know, communication is key, how they're feeling, what they need, and the sooner the better.
If they have questions, I would encourage them to call our number, the appointment line, and tell the person who's answering the phone that they'd like to speak with the nurse, the triage nurse, and then we can help them from there. A lot of students I know don't like to call, but that is really the best way to get some questions answered and get some good information, some good guidance on next steps. And I see there's a question real quick about flu shots. Yes, we will have flu shots available. We have not gotten them in yet. We usually get them at the end of September.
And pharmacy will have them. There'll be flu clinics. It's a whole thing.
Yep, and as all that happens, information gets shared with me. I put it in the Cat Chat family community. Dan, any final tips, things that families can do to get their students ready to manage life a little more independently?
It's such a hard question, but my final thoughts might be that one person gave me some advice when I was actually supervising a parent and family office at a different institution. And they advised the parents, every time you talk to your student, just ask them what they ate that day, because it allows you to know if they are going to the dining hall, how they're interacting with people, if they went out to dinner with some friends, those kind of things. That kind of innocuous question might be your real indicator of how well your student is doing. And teach them insurance. Anything you can do to get them ready to manage insurance, that's a life skill that's like beyond college, right? So.
Yeah, our last question that came in says, is a picture of their insurance card sufficient?
Yes, and you can upload, if you want to go ahead and sign up for My Chart on that link right there, you can go ahead and do that, and you can upload the front and back of the insurance card, and you're good to go.
All right, I knew we'd have a lot of questions today and a lot of good information shared, and we've had a few comments and feedback come in from families saying thanks to you for the information. And my hope with all of these webinars is that families come away from them with this sense that UK is a really caring community, and there are resources and support in and no matter where they turn. And so that's why I love being able to invite colleagues to share directly with you, so you can hear from them and hopefully, take comfort in the fact that there's so much support here for your student. If you think of other questions after the fact, don't hesitate to reach out email parents@uky.edu. We'll connect you with the campus partners that you've met through the Cat Chat Live series. We'll make sure that you get the information you need. But for now, knowing that we've gotten a little past 1 o'clock, we'll wrap up for the day. But want to thank Dan and Janie and Kelly for sharing such good information with you. And thank you to Kate for putting all of that good information, the links and everything in the chat for us. But families, thanks for your time. Thanks for being part of this group to support your Wildcat. And we hope to see you for the next Cat Chat Live. Thanks, everybody, and have a great rest of your day. Go Cats.